Good day everyone. In today's video we will be discussing the aquatic exercise. So the use of multi-depth immersion pools or tanks that facilitate the application of various established therapeutic interventions. So we use the immersion pools or tanks for performing the various activities or exercises. So purpose is to facilitate the functional recovery by providing an environment that augments a patient's ability to perform various therapeutic interventions. So main use of aquatic exercises will be increasing the circulation, muscle strength can be increased, joint range of motion flexibility, and ambulation is improved, coordination is improved. If we can increase the cardiovascular or respiratory conditioning can be done, the pain or spasm can be reduced, and the relaxation or psychological well-being of the patient. So these could be the goals. All the benefits of hydrotherapy are achieved through the aquatic exercises, but the difference is that we are performing the exercise in the pools. And in hydrotherapy, we are using the specific equipments like Hubbard tank, whirlpool bath, etc. So there are also special equipment for aquatic exercise. The aquatic equipment is used to provide buoyant support to the body or an extremity, and it can be to challenge or assist balance, or we can generate resistance to the movement, or we can add or remove the equipment. So first of all is the pools for aquatic exercise, which is the main. So it vary in different shapes and sizes, and the rooms in which pools are housed need to be adequately ventilated to avoid any accumulation of condensation on walls, windows and floors. So basic traditional therapeutic pools or individual patient pools can be there. This is the individual pool. So basic equipments for aquatic exercises like collar, rings, belt, swim bar, gloves, hand paddles, so kickboards. So all these are the equipments for aquatic exercise. They provide the buoyant support, they can assist the balance, and sometimes they generate resistance to the movement. So these are the equipments: inflatable cervical collar, flotation rings, buoyancy belt, swim bars or buoyant dumbbells, gloves, hand pedals. Then boots, kickboards, and ergocycles. So aquatic temperature and therapeutic exercise, because the water conducts temperature 25 times faster than air. So if the patient is moving through the water and molecules are forced past the patient, so temperature between 26 degrees centigrade and 33 degrees centigrade is the adequate one, and it is beneficial for the patients with acute painful musculoskeletal injuries, and it gives relaxation, decrease the muscle spasm. At this temperature, the exercise efficiency is maximized, stroke volume is increased, and heart rate is decreased. So we can also perform the intense aerobic training to minimize the risk of heat illness. Advantages of aquatic therapy will be buoyancy, so there will be weightlessness and joint unloading will be there. Hydrostatic pressure, it reduces or limit infusion. Viscosity, all the factors or all the physical or clinical uses of hydrotherapy are applicable in the aquatic therapy also. And basic exercise intervention using aquatic environment, stretchings can be done, strengthening, aerobic conditioning can be done. So basic stretching exercises, manual, like over here the therapist is performing the stretching for the cervical lateral flexion, shoulder stretching, lateral trunk flexions. Self stretching can also be done. This is a hamstring stretch. For strengthening exercises can be performed where the manual resistance exercises can be done where the resistance is applied by the therapist. And independent strengthening exercises can also be performed. So next is aerobic conditioning. So immersed cycling can be done. There are immersed treadmills available. Jogging can be done in the pool. So these are the main 4 variables that will be affecting the resistance or can provide assistance. So first is the position or direction of movement in the water, then water depth and lever arm length, and fourth is use of flotation or weighted equipment. So various activities to improve posture can be done. Activities to increase range of motion and flexibility. And cardiovascular training, walking, jogging, swimming strokes, immersed cycling or immersed treadmill can be used.